Americans are stressed out. Stress often leads to bad habits like overeating and smoking. These behaviors not only affect your waistline, but can cause damage to your gums. Here today to help us out is Dr. Stephen Daniel. Welcome, Dr. Daniel.
Good morning, Stacy. Thank you so much.
It's great to talk to you. So can you please help us understand the effects of stress on our bodies?
I can do my very best. You know, I tell patients when they come to the office that our goal is to help them be healthy, and they can't really do that without having a healthy mouth. And what we've discovered is that chronic stress can be a roadblock to people obtaining and maintaining good oral health. In this latest research, the focus was on saliva in the mouth. And while most of us don't think too much about the spit that we have in our mouths, it turns out that saliva is very protective, and among other things, it helps prevent the accumulation of bacteria around the teeth and gums. By doing that, when that's not happening, that additional bacteria increases the risk both of cavities and of periodontal disease. And periodontal disease is the #1 reason adults lose teeth. So it can definitely put your smile in jeopardy.
I just had my 6-month checkup, my teeth cleaning, and I am living in my second half of the century, so I do grind my teeth at night, and they said that is contributing to my gums receding. So what is the connection there?
Stacy, it's an interesting question, and there seems to be some evidence that suggests that if you're grinding your teeth at night, what we refer to as bruxing, the forces that are put on the teeth can create enough force to cause the attachment of the gum that you see and the underlying bone to begin to break down. And that's what people look in their mouth and they see the roots of their teeth and gum recession. I know that when my wife and I treat this condition, which is very common, one of the things we try to determine is if our patients have that sort of habit like what you've just described, we refer them to their dentist and let their dentist make a little appliance for them to wear that protects their teeth and reduces some of that stress on the teeth and gums and bone while they're sleeping.
Well, that's a great tip, but stress is a part of our life, and if we can eliminate it, how can we better cope with it?
That's an excellent question, and I want to preface my remarks by saying that stress reduction is not what I'm an expert in. But I can tell you that in the life that my wife and my partner and I have is that we try to eat well, we exercise regularly, we try to put a little distance between ourselves and our office from time to time. We love our jobs, but we basically try to find a balance in our life, Stacy. But sometimes the situations, if you're dealing with someone who requires chronic care for a health problem or these other issues, people just have to deal with it as best they can. And the nice thing is that there are physicians and support groups out there for helping people do this.
You mentioned the mouth guard for the teeth grinding, but what other precautions should we take to protect our bodies?
As far as periodontal disease is concerned, Stacy, I like to ask patients and people that I know to focus on keeping their mouth clean. Since this is a bacterial infection, if you can prevent the accumulation of this film of bacteria under the gum line, this is where all the action is in periodontal disease, by brushing your teeth well, using things like dental floss and other cleaners to get between the teeth and under the gum where the brush won't reach, and remove that bacteria on a regular daily basis, that is probably the best thing a patient can do to maintain good oral health.
It does seem like we hear more and more that there's a connection between our oral health and our overall general health. So where can my readers go for more information?
Let me suggest they go to perio.org, perio.org. That's our Academy's website, and I think your listeners may find two very useful things there. One is a description of periodontal disease, its symptoms, how it's treated, the links and relationships it has with other aspects of our overall health. But also there's an easy-to-use tool for your listeners to find a periodontist near them. We are the experts in the diagnosis and treatment of periodontal disease, and we're delighted to work with patients and their doctors and their dentists and hygienists in order to help that patient get healthy and stay healthy.
Well, Dr. Daniel, thank you so much for some great information here, and we can always go find more at perio.org. Thank you for your time.
Stacy, it was my pleasure. Thank you.
And have a great day.
And you as well.